a disease which causes liver failure, liver cancer, even death. So I'm gonna explain about this. If you're not subscribed, subscribe our channel to connect with us. The disease is Hepatitis C is an infection caused by a virus that attacks the liver and leads to inflammation. Most people infected with the Hepatitis C virus (HCV) have no symptoms. In fact, most people don't know they have the Hepatitis C infection until liver damage shows up decades later during routine medical tests. Hepatitis C is one of the several hepatitis viruses and is generally considered to be among the most serious of these viruses. Hepatitis C is passed through contact with contaminated blood, most commonly through needles shared during illegal drug use. Symptoms: Hepatitis C infection usually causes no symptoms until late in the course of chronic infection. In its earliest stage, beginning about 1 to 3 months after exposure to the virus, the following signs and symptoms occur in a small proportion of infected people: fatigue, nausea or poor appetite, stomach pain, dark color urine, yellow discoloration in the skin and eyes known as jaundice, fever, muscles and joints pain. Signs and symptoms of chronic infection typically become evident after years and are the result of liver damage caused by the virus. This may essentially include the symptoms of acute infection. Then over time, signs and symptoms may include bleeding easily, bruising easily, itchy skin, fluid accumulation in your abdomen known as ascites, swelling in your legs, weight loss, confusion, drowsiness and slurred speech, hepatic encephalopathy, and spider-like blood vessels on your skin, spider angioma. Causes: Hepatitis C infection is caused by the Hepatitis C virus, also known as HCV. HCV is spread when you come in contact with blood contaminated with the virus. Risk factors: your risk of Hepatitis C infection is increased if you are a healthcare worker who has been exposed to infected blood, such as may happen if an infected needle pierces your skin, have ever injected or inhaled illicit drugs, have HIV, received a piercing or tattoo in an unclean environment using unsterile equipment, received a blood transfusion or organ transplant before 1992, received clotting factor concentrates before 1987, received hemodialysis treatments for a long period of time, were born to a woman with the Hepatitis C infection, were ever in prison, were born between 1945 and 1965, the age group with the highest incidence of Hepatitis C infections. Complications: Hepatitis C infection that continue over many years can cause significant complications such as scarring of the liver tissues, cirrhosis. After 20 to 30 years of Hepatitis C infection, cirrhosis may occur. Scarring in your liver makes it difficult to your liver to function. Liver cancer: a small number of people with Hepatitis C infection may develop liver cancer. Liver failure: a liver that's severely damaged by Hepatitis C may be unable to function adequately. In the treatment, we use antiviral medicines and maybe need liver transplant, and vaccination is available. Lifestyle and home remedies: protect yourself from Hepatitis C by taking the following precautions. Stop using illicit drugs. If you use illicit drugs, seek help. Be cautious about body piercing and tattoos. If you choose to undergo piercing or tattooing, look for a reputable shop. Ask questions for hand about how the equipment is cleaned. Make sure the employees use sterile needles. If employees will not answer your questions, look for another shop. We are uploading daily medical videos about diseases and treatment. If you are interested, so click on the subscribe button to connect with us. Be healthy and be health provider.